I would like now to welcome two authorities in this event who came to the opening also, so that we can start properly. And I would like to start welcoming to the stage to Ms. Barbara Pons, Commissioner for the 2030 Agenda of the Barcelona City Council. Welcome to the stage. Thanks.
Well, thank you very much. And on behalf of the City Council of Barcelona, I am very proud to welcome you all, and we're extremely happy to see so many people. They tell me there's as much people online also following us. So, well, be very welcome to our city and to this very special venue that welcomes you during the whole day today. We hope you do have a very productive day. I am also at the City Council the Commissioner for the 2030 Agenda. I don't know if many of you are familiar with these 17 Sustainable Development Goals that United Nations launched in 2015, and it's guiding also the policies and the activities and the planning of the City Council. I want to point out that this very event and this initiative is aligned with at least 3 of these SDGs that I think they are very relevant. Number 3, health, of course. Health for everyone and sustainable. And I think this is one of your objectives, which is one of them that the city of Barcelona also is betting on. But also SDG number 9 is the SDG of the 3 I's. It's industry, infrastructure, innovation. And I think you are at this very front of innovation. It's something we really need in order to push forward this basically this transition, also the digital and the environmental transition that all cities and all societies are immersed. And also SDG 17, so necessary, public and private collaboration, institutions such as La Cambra, innovation from the local ecosystem, universities, research centers, companies, startups, and public administrations, trying also to innovate ourselves and to help to provide the ground you need in order to innovate in the health sector. What Barcelona, we are really, we want to contribute to your initiatives, and I think we have a great, and in the environment of Catalonia, we have a robust public health system, and also we have a robust innovation ecosystem in the digital sector. And I think the combination of both in this fantastic city, I think it's what's kind of creating this climate, this innovation climate that we really hope boost forward. We were discussing before. We would like this first event, this first Congress to become something similar to the Mobile World Congress. Why not in the future on the health system? We think you do have a bright future ahead, and we hope the city of Barcelona is ready to provide everything you need to do this with success. And I want to finish my intervention by congratulating the organizers of this event, Christian, Oscar, Luis, and Eva, and all the team of the Barcelona Health Hub for 4 reasons. First, for having this amazing idea in 2018 to create this Barcelona Health Hub, to plant the seed of everything that we are going to be seeing today. Second, for choosing the logo, and I think the logo is something fantastic. If you can see, it's not the logo, this logo, it's the logo they wear here. I'm wearing the SDGs, but they have this fantastic logo which blends Barcelona, the pavement, the very pavement of the city with health. And I think this idea of the city providing the environment for something to happen related to health. And health is also, if any of you know a little bit of the urban history of Barcelona, health is at the core of the Barcelona Eixample and the Cerdà Plan, which is the origin of the city. And I think we want it to continue so. E-health to be also the future of the city. Third, for having the great idea to organize, to transform these summits into a congress, something bigger to grow, because we need this sector to grow and to embrace the future challenges. And fourth, for choosing this building. This building represents something that from the City Council we are trying to push forward, which is the Barcelona Innovation Coast. We, from the City Council, launched this initiative to try to bring Barcelona from the success into the tourism and what we call the economy of the visitor sector. Barcelona is well known in the world for Gaudi, for food, for the beach, for the climate, but we also want to be known in the world for innovation. We are a coast of innovation. We have an amazing ecosystem. We have everything we need to keep innovating and and sharing with the world everything we are capable of. So please have a great stay in Barcelona and have a very productive day today. Thank you.
Thank you. Thank you, Ms. Pons. Barcelona Boosting Innovation is quite a very connected city. Well, we know now Christian has to become John Hoffman. Eva, you have to move also to FIRA. Well, these things happen. Well, thank you very much, and we keep on with the authorities. Now time to speak and to listen to Albert Castellanos, Secretary for Enterprise and Competitiveness of the Department of Enterprise and Employment and CEO at Axio. Please, welcome to the stage.
Well, good morning, everyone. First of all, Mr. Raquel Diotti, Secretary General of Research at the Spanish Ministry of Science and Innovation, Mrs. Barbara Pons, Commissioner of the 2030 Agenda of the Barcelona City Council, Mr. Christian Pascual, President of Barcelona Health Hub, the whole team of Barcelona Health Hub, and ladies and gentlemen, good morning, everyone. It's really an honor to take part of this institutional welcome on behalf of the Generalitat de Catalunya, of the Catalan government. As far as I understand, today I'm feeling that we are not celebrating just the first edition of another Congress taking place in Barcelona. I have the feeling that we are doing something bigger than that. I think that we are all together raising international awareness about the great social and economic opportunities that digital technologies are creating within the health sector, first of all. And secondly, somehow we are signing, from a public-private perspective, a declaration of intent that we want to lead this social and economic revolution from Barcelona, from Catalonia. We have a look at the figures and the prospects. We may understand the magnitude of this challenge that we are facing nowadays in the digital health sector. The digital health sector revenue worldwide is expected to show an annual growth of over 16%, resulting in a projected market volume of more than $550 billion by 2027. And from Catalonia, we definitely showed that we do not want to miss this opportunity. Digital health investment in startups in Catalonia increased fivefold over the past 5 years. The number of rounds doubled in the same period, and the number of international VCs, venture capital funds, investing in digital health companies in Catalonia increased sixfold in the same period. Economic opportunities that are also social opportunities to improve our health system. We have to be completely aware that digital technologies bring us a unique chance to evolve towards a more affordable, more accessible, more personalized, a more cutting-edge health service. Together with some no minor challenge, such as the absolute need to preserve, for example, the privacy of the personal data used in digital health, or to narrow the current digital gap. That's why we are so enthusiastic to take part of this call to action that we think that is this first edition of the Health Revolution Congress from Axio, from the Catalan government, organizing an Open Innovation Challenge, facilitating B2B meetings, meetings with other companies, innovative tech providers, or other startups, embracing at the end what we think is necessary today, also in the digital health sector, which is the open innovation dynamics. But it is fair to say, I cannot end my speech without saying, that none of this wouldn't have been possible without the firm leadership of Barcelona Health Hub. That's why I would like to express my sincere gratitude to Mr. Christian Pascual, President of Barcelona Health Hub, Mr. Oscar Garcia Esquirol, Vice President of Barcelona Health Hub and Medical Director, also to Eva Rossell and Luis Martinez, and at the end, the whole team of Barcelona Health Hub that at the end made what it seemed unachievable possible today. More than 1,500 attendees, over 60 international reputed speakers that will be participating today. So that's amazing. That's thanks to your perseverance and hard work in the last months. Congratulations. Hoping and willing that this Health Revolution Congress will create the right atmosphere to explore today's digital health solutions for the health challenge of tomorrow. I wish all of you a fruitful Congress, and as Christian said, let's lead this health revolution. Thank you very much.
Thank you. Thank you, Secretary. Thank you very much. I would like now to give and extend the floor to Raquel Iotti, Secretary General for Research of the Spanish Ministry of Science and Innovation. Please, welcome.
Good morning, authorities, ladies and gentlemen. Let me start by thanking the organizers for giving me the opportunity to be here today on behalf of the Spanish Ministry of Science and Innovation. We all know that the Spanish health system is an internationally recognized model characterized by the quality, but also by the equality in the provision of services. But we also know that the pandemic and its consequences on health and on the economies of the most developed countries has demonstrated that the next stage in the health protection and promotion must be based on a qualitative transformation of the health sector closely related to science and innovation. And for this reason, the Ministry of Science and Innovation has been very actively collaborating to support the process of promotion and protection of health based on the development and incorporation of innovative products, procedures, and digital solutions that offers added value to the prevention, diagnosis, personalized treatment, and rehabilitation of patients. Digital solutions offer a great opportunity for improving quality and saving cost, but also imply new challenges that we need to identify and prevent. And let me share only three of them. The digital transformation of healthcare should focus on the needs of citizens and on the expectations of professionals. What is usually called user experience is of great importance in the healthcare system, especially when the healthcare system is under stress. And forgetting the needs and the expectations of patients and professionals may lead to make the wrong decisions about the design, the procedures, the technology that we need. Second challenge, technology should be incorporated in the whole system, with a particular emphasis in the strengthening primary care, that is the base of the system. It is not enough to incorporate technology in the hospitals. And the third reflection is that the implementation of the digital transformation in healthcare must be also oriented to improve equality in the access. New causes of healthcare exclusion related to digitalization must be identified and prevented, and this is very important in our national health system. It is very clear for all of us that the pandemic has accelerated the transformation, in the digital transformation in healthcare, but also has demonstrated the need for a well-defined digital health strategy for the national health system. We need it. And in 2021, with the leadership of the Secretary General of Digital Health in close coordination with all the regional administrations, the Ministry of Health published the Spanish Digital Health Strategy. And this strategy has 4 main objectives, and I'm not going to read all of them, but the objectives are focused on people, on the needs and expectations of people, and in giving them the instruments, the tool to take care of their own health. It is also focused on professionals and into the need to change the processes within the hospitals and in the primary care attention. Is also focused on the need to adopt data management and governance policies to make possible to an interoperable and quality information, creating a national health data space that is crucial for generation of knowledge, scientific knowledge, and also for the evaluation of the services. And finally, there is an objective that is focused on the need to adapt the evolution of the national health system to the demands of today's society that are changing, and we need to adapt, providing innovation oriented to what is called 5P medicine, that is population, preventive, predictive, personalized, and participatory. And I would like to close with this concept about precision medicine. That is one innovative approach that is founded in science and innovation. And it must be understood as a clinical process that incorporates the genomic data of the patient, but aggregates this information with clinical data, environmental exposure, and living habits and socioeconomic data. We need to integrate all this information to provide new useful information for the clinical decision process. So it's a clinical process, and we need to understand it in this way to engage with clinicians, because at the end is a way to make medicine for patients. And in this process, in this integration process, we need data science. It is crucial to have the tools and the processes to use all the information that we have for improving the care to patients. And in this innovative clinical approach related to precision medicine, this is the key element of the strategic project for economic transformation and recovery, what we call in Spain PERTE, is the PERTE de Salud de Vanguardia, or PERTE for the cutting edge health, and is based in this general principle. And now we are implementing this strategic project, and we are not doing alone, the administrations, but with the contribution of all the stakeholders that we need to have success in this issue. And well, you are going to have today the opportunity to enjoy this Congress that has a diverse and very compelling agenda that promises, I'm sure, to inspire and also challenge the way we approach healthcare. You are going to be able to share experiences and perspective on how digital health can integrate in clinical practice, and I have just mentioned, insights into enhancing patient satisfaction, engagement, and well-being, and initiatives that reimagine the way we deliver healthcare to our youngest and more vulnerable patients, addressing gender inequity in women's health through preventive care, and many other very interesting subjects. I wish you a memorable and inspiring Congress, one that sets the stage for a future filled with innovation, enlightenment, and positive change. Together, Let us reimagine healthcare and pave the way for a healthier and more equitable future. Thank you very much.